Hello,
Hi.
my name is Ximena.
Hi.
I'm going to be your nurse today.
Okay.
Do you consent to me doing a lung and cardiac assessment?
Yes.
And do you consent to it being recorded?
Mm-hmm.
Okay. Can you tell me your first, your last name, and your date of birth?
My first name is Adelaide, last name Gentry. My date of birth is 3/7/1944.
Okay. Do you have any allergies?
I'm allergic to morphine.
What happens whenever you get morphine?
I get really itchy and I break out in hives.
Okay, so hives and itching. Okay. Can you tell me where you are?
I'm at Bearcat Hospital.
Can you tell me why you're here?
I have some really bad chest pain.
Okay. And can you tell me what year it is?
It's 2022.
And can you tell me your name again?
My name is Adelaide Gentry.
Okay, so patient is alert and orientated ×4. Okay, so I'm gonna ask you a few questions, all right? Okay, so have you had any chest pain or tightness?
I've had some chest pain.
Okay, we'll get back to that. Have you had any shortness of breath?
No shortness of breath.
Have you had any fatigue or lightheadedness?
No.
Have you
Actually, yes, I've been lightheaded, sorry.
Okay, so fatigue and chest pain.
Yeah, fatigue,
Okay.
lightheadedness.
Okay, and then have you had any cough?
No cough.
So no cough. Have you had any swellings in the legs or feet?
No.
Have you had to like wake up in the middle of the night to go urinate?
Mm-mm.
Are you a smoker?
No.
No, you're not a smoker. Okay. Have you had any past history of lung or cardiac diseases?
No.
Okay. Have you had any history of hypertension, diabetes, or high cholesterol?
Mm-mm.
Okay. Are you up to date with all of your immunizations, like your TB, your flu, your pneumococcal?
Mm-hmm.
Yeah.
I've had those.
You've had those. Okay, that's good. So about your chest pain, when did it start?
It started while I was watching TV last night.
While you're watching TV.
Mm-hmm.
Is there anything that made your chest pain better?
I had to like physically get up and kind of move around.
Okay. What was the quality? Was it like a sharp? Was it throbbing? Did it?
Oh, it's kind of like a sharp chest
sharp
pain. Yeah.
Okay. Did it radiate anywhere? Was it like staying in one place, or was it going all over your chest?
It stayed mostly in my chest.
Okay. How severe is it on a scale of 0 to 10? 0 being no pain, 10 being the worst pain ever.
I would give it about a 10 out of 10.
10 out of 10.
Yeah,
Okay, that's
a lot of pain.
That's a lot of pain.
Yeah.
Okay. And timing, you said it started last night?
Mm-hmm.
Okay. And how is it affecting you and your daily activities? Does it let you do anything?
No. Since the pain's a 10 out of 10, I can't do anything.
You can't do anything?
No.
Okay. And you also said you had some fatigue?
Yeah, I started noticing those. I've been really tired lately.
About when did you notice this fatigueness?
I would say about a week ago.
About a week ago? Okay.
Mm-hmm.
Is there anything specific that causes the fatigue?
Like if I'm getting up too much, even if I'm laying down for too long, I start.
Okay, so what makes it better? Walking or sitting or?
It just comes and goes.
It just comes and goes.
Nothing that makes it worse or better.
Okay. What's the quality of this fatigue? Do you feel fatigued all the time, or?
It's just different periods throughout
Different
the
periods.
day. Yeah, it doesn't really have a pattern.
Okay, and radiate doesn't apply. Timing, you said it comes and goes?
Yeah, it just comes
and goes
throughout the day. Yeah.
Okay, and how does it affect your daily activities?
I'm really tired. I don't want to do anything.
You don't want to do anything?
Yeah, no.
Okay. All right. Okay. Okay. Now I'm going to go to your back. Okay. I'm just gonna go to your back. Okay. And I'm going to do a general survey first, actually. So patient is relaxed, patient is cooperative, patient has an erect posture, clothes are appropriate to the weather outside, patient has a relaxed position, they are alert and orientated ×4, and patient. Also, do you have any swelling in the in your feet? And you like,
No.
no?
No.
Okay. And patient's speech is clear and concise. Mood and affect match. It is good. Okay. Okay. So now I'm checking for the posterior back. So position is erect. Shape appears symmetrical. Skin color is evenly distributed. Skin color matches patient's ethnicity. No rashes, no lesions, no cyanosis, no pallor. So now I'm going to check for your symmetry, okay? Okay, I'm going to place my thumbs on T9 and T10, and then I'm gonna have to ask you to take a deep breath in for me. And out. Okay, chest expansion is symmetrical bilaterally. Now I'm going to do for the tactile firmitus. If you could please say 99 for me whenever you feel my hand.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. Firmitus is good. No abnormally increase or any decrease in firmitus. Now I'm going to auscultate for your breath sounds. So I would do 18 spots, but for the purpose of this assessment, I'm going to do 12. If you could take a deep breathe in and out for me whenever you feel my stethoscope. Vesicular breath sounds sound normal, no presence of any adventitious sounds, but there is signs of shortness of breath. Okay, now I am going to go to your in front of you. Okay, now I'm going to look at your neck. I'm going to make sure if you could lift up your chin. Make sure that trachea is midline. Looks good, midline. Now I'm going to check for your carotid artery. I'm going to press my fingers on here, okay?
My heart rate may be a little fast.
Oh yeah, thank you. I did notice that your rate is pretty fast, but your rhythm is regular, irregular, I think. Your force is about +2. Yeah, rate is fast. Your force is a +2. Are you feeling any palpitations with your heart rate?
Mm-mm.
Okay. Now I'm going to check for any bruise. If you could please breathe in for me and breathe out, and then hold it. First, I'm going to check with the diaphragm and then the bell. to check the bell now. Okay, no signs of any early bronchial breath sounds. Sound normal, no any adventitious sounds, but the rate is very fast. Okay, now I'm going to check for the breath sounds. On inspection, skin color is evenly distributed. Skin color matches patient's ethnicity. No rashes, no lesions, no cyanosis, no pallor. Okay, now I'm going to check for your symmetry. Okay, I'm going to place it on the xiphoid process. If you could please take a deep breathe in for me and out. Okay. Chest expansion is symmetrically bilateral. It is good. And now I'm going to do for fremitus. If you could please say 99 for me whenever you feel my hand. Okay.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. Fremitus is good. No abnormally any decrease or any decrease in fremitus is good. Okay, now I'm going to check for your breath sounds. I'm going to check 10. If you please take a deep breathe in and out for me when you feel my stethoscope. No noticeable adventitious sounds. They sound normal, but breathing is a little fast due to your shortness of breath. Okay. Now I'm going to check for your heart sounds. And upon inspection, you do appear to be using your accessory breathing muscles, and you do appear some little nasal flaring. So you may be in respiratory distress. Okay, so now I'm going to check your heart sound. First with the diaphragm, then the bell. So I'm going to check the aortic, pulmonic, or tricuspid mitral. Okay. So aortic. Which is on the right second intercostal. Pulmonic, left second intercostal. Herbs, third intercostal on the sternal border. And then the pulmonic, which is on the fourth intercostal on the sternal border, and then your mitral, which is the fifth intercostal in the midclavicular line. They all appear to be kind of fast due to your fast heart rate. Now I'm going to compare the mitral pulse with your, but now I'm going to do the bell first. So I did the diaphragm, now I'm doing the bell. no presence of any murmurs. Now I'm going to check your mitral pulse, compare with your radial pulse, okay? Okay. And I would listen for 60 seconds, 1 minute. Okay. Mitral and radial pulse coincide with each other. Okay. Now I'm going to check for I'm gonna ask you to lay down. Okay. And then I'm going to check for your jugular vein. So if you could please lay down for me. Lay down for me. And then upon inspection, I see no jugular vein distension. Could you please turn to your left? Okay, yes, no distension. Okay, now I'm gonna raise it up a little bit and then see if it. Here. Okay, so no jugular vein distension. Okay, here you go. You can stay here down. Okay, so I'm gonna check for your temperature on your arm. Patient is warm. They're both warm. It is smooth, dry. It's good on both arms. And then I'm going to check for any edema. So patient has no edema. Now I'm going to compare the radial pulses. Okay. Force about +2. Rate and rhythm. Rate is fast on both bilaterally. Okay. Now I'm going to check for your capillary refill. Okay. They are less than 2 seconds, so. Okay. Now I'm going to check for your lower extremities. Okay, I'm going to lift up your hands, okay? Okay. Okay, so I see no pitting. Okay, now I'm going to check for the temperature with the back of my hands. So lower extremities are warm, smooth, dry, bilaterally. Okay. Okay, now I'm going to check for the posterior tibial pulse, okay? So I'm going to take off your socks, is that okay? That's fine, okay. Okay. Okay, so I'm going to okay. Pulse is good. Rate is kind of fast also. Force is a +2. Now I'm going to check for your pedal pulses, okay? Okay, force is about a +2. Okay. Now I'm going to check for your capillary refill. Since I see that you have some nail polish, I'm going to use the tip of the toes, okay? Okay. It's less than 2 seconds. Okay. Okay. Are you comfortable?
Yes.
Do you need anything?
No, I don't need anything.
Are you okay? So you're okay?
Mm-hmm.
Okay, so I'm going to lower the bed. Oh, it's already lowered. Okay, I'm going to. Is this position good for you?
Mm-hmm.
Okay, so bed rails are up. The brake is locked. Okay, and I'm going to give you your call light. If you need anything, you just press on that button, okay?
Okay.
I'll be, and if you need me.